from this side to welcome the new Permanent Secretary, GSO, Dr. Maurice Berry. Please, can we give me a round of applause? At this point in time, may I please invite the chairman of PTF to please begin today's proceeding, as usual, to be followed by the Honorable Minister of Health, and then the DGNC, DC, and the National Coordinator will also follow suit. May I please invite the chairman of PTF.
Members of the Federal Executive Council, members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I sincerely welcome you all to the national briefing by the Presidential Task Force PTF on COVID-19 for Thursday, 8th October 2020. Since the last time the PTF briefed the nation on the 29th September, we have celebrated the 60th independence anniversary of our dear country, Nigeria. The PTF, therefore, wishes all Nigerians happy Diamond celebration and a prosperous and peaceful future. The Presidential Task Force has, within the intervening period, welcomed the new Permanent Secretary, GSO, Dr. Maurice Berry, into its fold. He has, however, been introduced by the Director of Information in the Office of the Secretary to the Government of the Federation earlier. He will carry on from where his predecessor, Barrister Olusegun Adekule, stopped, largely as the accounting officer and the link between the multi-sectoral response and the bureaucracy. I therefore take this opportunity to introduce to you the new Permanent Secretary. Like I said, he has already been introduced, and to welcome him to this beat. The Presidential Task Force could not brief the nation last Monday due to the two-day executive legislative retreat held at the instance of Mr. President to foster a good working relationship between the executive and the legislative arms of government. The retreat was, however, productive as we continue to work on a better relationship for the good of the nation. As you are all aware, the type of synergy built between the executive and the legislature has become a model for national development, particularly in our response to COVID-19. We therefore thank the National Assembly for the support and collaboration so far achieved. The situation of COVID-19 in Nigeria continues to give the PTF serious concern, especially as it relates to testing. In the week leading to the Nigeria's 60th independence anniversary, we noticed the drop in the number of confirmed cases and a further reduction in the number of states reporting new confirmed cases, while the rest of the world continued to declare high numbers of cases and fatalities. Brazil has indeed crossed 5 million confirmed cases and recorded over 150,000 fatalities. Other countries like France, Italy, Israel, Britain, etc., are reintroducing more restrictions and measures to curtail the spread of the pandemic in their countries. In order to ramp up testing, the full implementation of a national testing week will be confirmed shortly, where we will go out and test in each and every local government of the Federation. On the African continent, 10,615 cases were reported from 36 countries, leading to a cumulative total of 1.45 million, including 37,153 deaths. Globally, over the last few weeks, 5,909 deaths were reported from 100 2 countries and territories worldwide, with South America, largely Brazil, accounting for 26%, about 1,510 deaths of all deaths reported in the last 24 hours. Cumulatively, 1,060,002 COVID-19 deaths have been reported worldwide as of today. The global case fatality rate has gradually declined to 2.9%. Although Nigeria is no longer in the top 5 countries by cumulative deaths in Africa, the Presidential Task Force continues to urge Nigerians to change their attitude of skepticism and nonchalance to the virus. For the avoidance of doubt, the virus is still real, ferocious, and deadly. To date, Nigeria has recorded 59,738 confirmed cases and 1,113 fatalities. The Presidential Task Force is fully conscious but not deceived by the fact that our recovery rate is high and very encouraging. We still urge, however, that everyone should get tested, because testing is the only way to detect, isolate, trace, and treat. Media reports have suggested that many Nigerians do not trust the government and its agencies. We need to continue to build mutual trust between government and the governed if successes already recorded are to be sustained in the fight against COVID-19. The Presidential Task Force and relevant agencies are working with the European Union on the issue of flights into Nigeria. As soon as negotiations are completed, Nigerians will be informed accordingly. For flights currently allowed into Nigeria, we are seeing a combined number of 4,500 arriving passengers per day into Lagos and Abuja. On a very sad note, we have received the report of the untimely death of Mr. Uche Unjoku, a laboratory expert with the Nigerian Center for Disease Control, who was shot while on official trip by unknown gunmen. The PTF commiserate with his family and all frontline workers on this painful loss. We also wish the other workers in the vehicle that were injured a quick recovery as we pray for the repose of his soul. This incident underscores the danger that frontline workers face in the course of fighting this virus on our behalf. Because Mr. Uche Unjoku went on an official duty to supply support to different states, and he was caught in the web of unknown gunmen, and eventually in the process, he lost his life. We urge all Nigerians to continue to pray for the safety of all frontline workers and their families. Before I round up, let me remind all Nigerians that, like our Diamond Anniversary celebration, the COVID-19 has made year 2020 a most significant year for us in Nigeria. We need to do all we can to survive it, and we have the solutions in our hands. I say, together, let us take responsibility. I now call on the Honorable Minister of Health, and thereafter the DG, Nigerian Center for Disease Control, and the National Coordinator, and subsequently other members of the Presidential Task Force, to provide us with details. I thank you for your kind attention, and have a good evening.
Secretary to the Government of the Federation and Chair of the Presidential Task Force on COVID-19. honorable ministers, national coordinator, permanent secretaries, directors, DG, ladies and gentlemen, I join the chair of PTF in wishing you all the very best after the 60th independence anniversary celebration as we enter the next decade in the life of our country. It is an opportunity to rededicate ourselves to the service of our country and for the betterment of mankind. I also join in thanking Mr. Segun Adekunle for the service he has rendered to his country and to the government, and in welcoming his successor, Dr. Maurice Mbari, who's here watching this procedure. He will soon take over the formalities of Mr. Adekunle. I express condolence to the Nigeria Center for Disease Control on the loss of one of their staffers in the course of duty in a violent incident. I have directed the Permanent Secretary of the Ministry of Health to send letters of condolence and to activate the processes for the life insurance that is promised by the PTF. The Director General of NCDC will be visiting the family to carry the condolences of the government. In the past 24 hours, Nigeria recorded 155 COVID-19 cases, bringing the total confirmed cases to 59,738 out of 543,415 persons tested so far. That is just over a quarter of the 2 million that we are pursuing. 51,403 patients have been discharged, and 1,113 fatalities have been sadly recorded in the 36 states and Federal Capital Territory. The recorded recovery rate is 86%, while the case fatality has dipped very marginally to 1.85%. Positivity rate has declined to about 5%. Do we have reason to be happy or to rejoice? We look at global developments, we need to be very concerned. And what is our situation? At a meeting of West African Ministers of Health under the West African Health Organization was held on the 29th of September 2020 by video conference to review our sub-regional experience in the management of COVID-19 pandemic, as well as the protocols for resumption of sub-regional travel and cross-border commerce. His Excellency, the President of the Federal Republic of Nigeria, as we all know, is the ECOWAS COVID-19 champion. A part of the learning from that meeting is that the COVID-19 pandemic is evolving along similar patterns of decline in the cases and fatalities in West Africa. While this provides some comfort that we are not out of place in our sub-region, we still have no reason for complacency. The so-called second wave of the COVID-19 outbreak we are seeing in several European countries and across the Atlantic, in Brazil, Argentina, and the United States, they give us reason for serious concern, coming as they do on the heels of what appeared to have been the control they gained over the disease. They thought they had gained control, but they have serious problems arising all over again. As schools and economies reopen and international flights increase, we are concerned that there may be a surge in the number of positive cases that can happen here if we do not take steps and respond properly with our strategy of trace, test, isolate, and treat. Some of the countries affected have been compelled to reintroduce stricter social restrictions like closure of restaurants and bars, prohibition of gatherings of more than 6 persons, compulsory wearing of masks outdoors, which was announced by Italy this morning, targeted lockdowns, etc., as has been announced by Brussels, all in order to address the sharp increase in COVID cases in their countries. A few countries who have strong health system are in fact also showing signs of stress, and they're having to transfer patients from one hospital to the other where there is overcapacity or undercapacity. And we are particularly worried about this huge increase in COVID cases in certain countries with which you know that we have high volume of human traffic. The Federal Ministry of Health therefore wishes to advise Nigerians against non-essential travel to high-burden countries, especially those Nigerians who have comorbidities that are well known and who are at higher risk, the non-communicable diseases. The risks that the movement of travelers create can only be countered by improved surveillance programs. I wish to especially solicit that all travelers, especially arriving passengers, please cooperate with border authorities to protect our country, our people, and our health system from stress. We are obliged to reduce the risk of COVID importation to Nigeria to a minimum, especially since many people who arrive may still be without any symptoms. As of September 22nd, out of 1,473 persons of interest who were tested in the Federal Capital Territory since opening international travel, 22 were found to be positive for COVID-19. Our testing and tracing capabilities have improved a lot, such that every state of the Federation has at least one laboratory. That has increased our daily testing capacity to over 3,500 per day. And we are, however, still testing well below that capacity because laboratories are receiving fewer samples than they could handle, leaving some of our development partners to start doubting our reports. I therefore request state governments to improve on sample collection and capacity utilization. All persons with COVID evocative symptoms or who may have come in contact with a confirmed COVID case or who may have recently arrived from abroad, particularly from a high-burden country, are eligible to submit themselves for testing. Here to further examine developments in our country, the CMDs and medical directors of all federal hospitals and institutions who had their quarterly meeting in Abuja yesterday provided the Federal Ministry of Health with the opportunity to address them and charge them with higher responsibility. Among these responsibilities, the need for increased vigilance in their hospitals and their emergency centers so that in case they observe increases in attendance by persons suggestive of COVID-19 infection, these are promptly detected and reported for follow-up. Disease surveillance and notification officers at local government areas and incident managers at state level are also urged to be on alert to immediately report cases of unexplained illness or deaths, even in remote locations of their state. These are the measures we need to put in place to be able to observe the impact of returning passengers to our country and the reopening of schools and cross-border travel and trade. With regard to rapid diagnostic test kits, we are advised that sensitivity and specificity is about 85%. NCDC and WHO can talk about that later on. And the use is limited to certain circumstances. The Federal Ministry of Health will be organizing a primary healthcare summit in the second week of November to unveil the agenda of the President on basic health care and the areas of emphasis in our march towards universal health coverage. Basic Healthcare Provision Fund is in full operation, and all eligible states have received their allocations. We particularly appreciate the allocation to the Ministry of Health in this year's budget, which will allow us to spend sensibly and towards achieving goals of universal health coverage. The Basic Healthcare Provision Fund, the new manual of 2020, will be formally presented during the day when the Health Summit is holding. Thank you all for your attention.
Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers of Health, Environment and Aviation, members of the Presidential Task Force, gentlemen of the press. Good to be with you again. I have five quick updates for you this evening. Firstly, like the Honorable Minister of Health has said, after some very hard work across the country, yesterday we finally activated the 69th lab, public health lab, full PCR lab in Niger State, bringing it to 69 PCR labs, 22 DIN-expert labs, and 17 private sector labs, currently with the capacity to test for COVID-19 in our country, starting from 2 labs in January. The number of labs themselves are not going to solve the problem, but they do solve the proximity problem for most people and bring testing opportunities closer to people. It is up to us, ourselves, doctors, physicians, healthcare workers, public health workers, to use these labs to the full potential and enable us create more awareness on the importance and utility of testing to manage this outbreak that we face. But at least right now, there's an opportunity to test in every state in Nigeria, and we don't have to transport samples from one state to the other and across the country, as we have been doing since the beginning of the year. The second update is an introduction of 2 new antigen-based rapid diagnostic test kits that have been recently given emergency use licensure by the World Health Organization. These 2 test kits are BD Biosensor and Abbott. They do have their limitations, but they also do have their benefits in terms of cost, a shorter turnaround time, and opportunity for both clinicians to quickly refer the patients for treatment when there's a positive case, and for public health workers to initiate a public health response. So we're going to work to define the context in which they can be used over the next few days and publish that on our websites. They're not going to replace PCR-based testing for the population, but we will target their use in specific circumstances, in schools, in closed settings, schools, prisons, NYSC camps. So whenever you have a collection of people in a certain closed setting, and also in certain circumstances, in work settings, etc. So we'll be publishing these guidelines very soon, and therefore give public health workers an extra tool to use in the diagnosis of cases. Thirdly, this outbreak has provided us an opportunity to complete the rollout of SORMAS. SORMAS is a digital case-based surveillance system to every local government in the country. This was a very slow and painful process, but the effort, energy, resources that have come in to support this outbreak has led us to accelerate the deployment of this digital surveillance tool that will not only improve the surveillance for COVID, but also improve the surveillance for all infectious diseases in the country. This has also been deployed to points of entry, airports and major land borders, working with our colleagues in port health services. And these are one of the innovative approaches through which we will improve the system altogether, and not just in response to the current outbreak. The fourth update I'd like to bring to you is, like I mentioned last week, we're implementing a seroprevalence survey for COVID in 4 states, Gombe, Nasarawa, Lagos, and Enugu states, in collaboration with the Nigerian Institute for Medical Research, who is leading the survey in Lagos, and our partners, US CDC. This survey is going very well. I'd like to thank very much the households where this survey has been implemented in these states, and especially our colleagues, the Honorable Commissioners of Health, Directors of Public Health, state epidemiologists in these 4 states, who have worked very hard with our teams, approaching households, seeking consent, collecting swabs and blood samples, through which we will confirm if they have COVID or not. And through that, these are randomly selected households, we will be able to answer that question many people have been asking. Is our data truly representative of the epidemiological situation in the country? We have also used the opportunity to administer a malaria test to everyone with this, and therefore, if they have symptoms and they test positive, they are referred for treatment. So, maximizing the opportunity of any intervention to provide other public health interventions as necessary. Finally, we've been working extremely hard with our colleagues in the Federal Ministry of Education to publish guidelines on a safe reopening of schools. Many states have already gone ahead, some are going ahead over the next few weeks, and the federal government, through the Federal Ministry of Education, has just announced the reopening of federal schools, primary and secondary schools. So we've been working with the Ministry of Education. There's no undertaking stakeholder meetings across the country. We have to find the balance between science and what is possible in our context. So it is not enough to say, do this, do that. We have to approach stakeholders, understand the circumstances in the schools, the facilities they have, the resources available, and reach a compromise between safety and being able to open. So there will be new guidelines published around requirements and the age cutoff from which students and staff are expected to wear masks. There will be requirements about minimum distancing between pupils. We understand that this may not be possible in every school in Nigeria, but it's important to put out the minimum advised guidelines from NCDC and advise every school, if you're not able to do that, to at least aspire to do that over the next few weeks. That will also give parents, teachers an opportunity to work together with the parents, teachers associations to look for the extra resources with the resources coming from federal and state governments to provide a safe environment for the reopening of schools. We've also been working with the National Youth Service Corps to support a safe reopening of youth service camps across the country. So a lot of collaborative effort across federal and state government agencies. We can only make progress in this outbreak by working together. So those are the end of my updates for today. I'd like to thank the Secretary to the Federal Government of Nigeria and the Honorable Minister of Health for their condolences. The staff of NCDC will continue to work hard despite the challenges day to day, to support the response, and we pray for the repose of the soul of our colleague, Uche Njoku, who is being buried today in Owerri, in Imo State. Thank you very much.
Chairman of the Presidential Task Force, honorable ministers, members of the PTF, gentlemen of the press, good evening. Today I'm going to briefly talk about the elections in Ondo, opening of schools, and clarify a bit about the international travel portal. I will start with the international travel portal. We've had a lot of queries with regards to the generation of QR codes or barcodes. The QR code can be generated after entering your health questionnaire and uploading your COVID-19 negative PCR result when you are coming into the country. This will enable you to generate a QR code that would clearly specify that you have not paid for the COVID test, but can still allow you to come to board. If you have paid, you can generate a second QR code, a final QR code, which will be the final one that will have details of your payment and tell you how to go about to do the lab test at day 7 on arrival. Now, the reason why we need the QR code is because we have to move away from paper copies of health questionnaires, and we have to move away from paper copies of COVID-19 PCR results. At the moment, we have not made the QR code mandatory for boarding, but in the coming weeks we will, and we are asking passengers to please familiarize themselves with the portal. Generation of the QR code is not dependent on payment, but it is necessary for travel, and it will be made mandatory in the coming weeks. With regards to the elections in Ondo, as we all know, on Saturday, Ondo State will hold governorship elections across 18 local government areas. We're expecting about 1.5 million eligible people to cast their votes across 3,000 polling units in the state. So this is clearly a huge exercise. It's a huge exercise that would also come with risks. Therefore, in order to protect voters, election officials, and candidates in the electoral process, we urge everyone to strictly comply with the INEC guidelines that we have worked with INEC to set up with regards to safe elections. For clarity, these are some of the key elements of the guidelines. Face masks are mandatory across all polling unit locations. No face mask, no voting. Physical distancing must be enforced, especially in queuing at polling units. Alcohol-based hand sanitizers will be provided. Polls will commence at 8:30 a.m. to close at 2:30 p.m., but anybody in the outer queue by 2:30 p.m. will still be allowed to vote. There will be 2 queues. There will be an outer queue and an inner queue, i.e. a 2-tiered queuing system. Voters will be brought into the voting area periodically from the outer queue into the inner queue in order to prevent overcrowding. Chairs, tables, and workplaces will be disinfected regularly. PPE will be provided to polling staff, including infrared thermometers for temperature monitoring. And at the close of the polls, staff will ensure that materials are disinfected properly and packaged carefully. We encourage all 17 political candidates of the Ondo elections to please lead by example. Public safety is our main priority, and we urge voters, candidates, and all election officials to adhere strictly to the safety measures that we have put in place with INEC. We must work together to ensure that the protocols issued by the NCDC, PTF, state committees on COVID-19, health authorities, and INEC are observed. We certainly cannot afford to lose the little gain we have made in the fight against the pandemic after the elections. With regards to opening of the schools, we have been asked frequently what guided our decision. So the sort of questions we've asked include, are schools able and ready to implement infection prevention and control measures. We've also considered the capacity of learning facilities nationwide to maintain safe school operations in order to mitigate risk. We've looked at the level of community transmission in those areas, the mode of travel, as well as other community-related risk factors. In doing so, the Federal Ministry of Education, the PTF, and NCDC have developed guidelines to ensure that schools can reopen, minimize the risk of transmission, and continue to operate safely. Schools and educational bodies that plan to reopen must have detailed communication protocols that include parents, school health teams, school authorities, and local state officials. They must also have a system for providing regular updates to parents, staff, and relevant authorities, as well as communicate changes to procedures effectively and clearly, as well as taking sufficient measures to understand how COVID-19 can spread and how you can mitigate transmission in line with official guidelines. Specifically, school authorities have the responsibility to ensure that everyone gaining access to their schools is screened properly, is wearing a mask, and sanitizing their hands. Boarding schools must have identified areas for screening and putting positive students aside. There must be access to running water of some sort and hand washing facilities. The health staff, particularly in boarding schools, must be trained and provided with PPE. There must be appropriate waste management systems. Health facilities that are within the schools, that serve the schools, should have the ability to cater for an outbreak, and a response protocol must be in place for day schools, students who fall ill or test positive. And in this regard, it is important to involve parents and make sure that parents have signed consent forms in advance in the situation that urgent testing may be required of students. Schools should also work in synergy with the local government rapid response teams and collaborate with the state ministries of health on planning, implementation, and opening of the schools. We encourage schools to consider creative solutions to abide by these guidelines. These include considering outdoor learning where weather and security permit, considering staggered attendance to avoid crowding of classes, or dividing classes into morning and afternoon sessions, alternate day attendance for students to minimize the number of students in each class, and adjusting teaching delivery, such as through the use of distant learning that will limit interactions, the use of multimedia materials, etc. The federal government has developed the procedures and protocols mentioned for the safe resumption of the nation's education system. We urge school authorities to adhere to them so that Nigerian schools can continue to be safe places for learning. Nevertheless, we must mitigate the risk of students becoming infected with COVID-19 to protect them, to protect their families, and our collective future. We must not take these guidelines for granted. It is our collective responsibility to protect students from exposure to the coronavirus. While we encourage teachers and parents not to despair with this new normal, because this is the new normal for now, it may be challenging for schools to resume, but in time, I am very certain that we will cherish the efforts that we have put in place to make sure that our young people have a safe and brighter future. Thank you.
Mr. Chairman, members of PTF, ladies and gentlemen, members of the press, good afternoon or good evening. Just a quick update from the Federal Ministry of Environment. Now that we are headed towards reopening our schools, I'll just take you back a little bit so that you will understand where we are coming from. Back in August, precisely the 3rd of August to the 9th, we have conducted decontamination and disinfection of the Unity schools, 105 of them, 21 in North Central, 19 in Northwest, 13 in Northeast, and 20 in Southwest, 14 in Southeast, and 18 in South-South. At the time, we have also deployed environmental health officers as a surveillance team to the various examination centers. And from our investigation collation, this went very well. There was really no incidents of any outbreak at any of these centers. Starting August 17th to the 23rd, we have covered 15,876 centers in the 36 states of the Federation, including FCT, and at the time have mobilized 39,300 environmental health officers for the surveillance of these examination centers. Now that we are gearing towards opening of our schools, we are again mobilizing 60,000 environmental health emergency response volunteers that will ensure safe reopening of our schools. This number may be increased depending on what we see on the ground at the first time. Of course, opening schools, going to classrooms, interacting with teachers, cafeterias is different from examination centers. So this time around, the environmental health officers will undertake much greater role in ensuring that teachers are trained, know what to do, students, the same thing, caregivers, conduct in the preparing of meals in cafeterias, everywhere, including non-academic staff of the schools. So this is going to be quite comprehensive. This is to show that we are not letting our guard down. Corona is still there. We are doing everything humanly possible to make sure we adhere to the protocols, the guidelines, and prevent any escalation of infection from corona. We have seen in places where they have taken it lightly when they opened their schools, and we have seen what happened. So we are not really letting our guard down. We are doing as if we are still where we are, even though we can see from the numbers that there's slight improvement, but we should not take anything for granted, just as the national coordinator has said. Jama'a assalamu alaikum. Muna so ne mai muku matashiya akan abubuwan da suka faru baya, ayyukan da aka yi, da kuma abubuwan da za a yi yanzu, musamman yanzu da gwamnatin ƙasa ta shirya don a koma makarantu, za a buɗe makarantu. A baya daga 3 ga watan Agusta zuwa 9 ga wata mun yi aiki na tsaftacewa da feshe makarantun gwamnati waɗanda ake ce musu makarantun haɗin kai. Arewa ta tsakiya mun tsaftace makarantu 21, arewa ta yamma guda 19, arewa ta gabas guda 13, kuma kudu maso yamma guda 20, kudu maso gabas guda 14, sai kuma kudu maso gudu makarantu guda 18. Shine in aka hada zai ba da makarantu guda 105 daidai. A lokacin mun yi amfani da jami'an lafiya na agaji domin tabbatar da cewa an kiyaye an tsaftace wannan makarantu, kuma an fara wannan ne daga 17 ga watan Agusta zuwa 23 ga watan Satumba. Kuma mun tsaftace, mun kuma kula kai da cibiyoyin jarabawa guda 15,876 a dukkan jihohin ƙasar nan wato guda 30 har da babban birnin ƙasa. Yanzu da za a buɗe makarantu wanda yake ya fita daban da cibiyoyin ɗaukan jarabawa, mun ƙara yunƙurin shigo da ƙarin jami'an lafiya guda 20,000 wato yanzu 60,000 kenan waɗanda za su kula da waɗannan makarantu domin su tabbatar da cewa an ci gaba da bin tsare-tsare da aka gindaya don guje ma yaɗuwan corona. Wannan annoba ta corona har yanzu tana nan, ana dai samun sauƙi daidai gwargwadon hali, amma me karme ma wannan rikon sakainan kashi ganin cewa a'a ta tafi tana nan. Mu ci gaba da kiyayewa. A nan jami'an lafiyan da za su kasance a makarantun nan za su tabbatar sun horar da malamai, sun horar da ɗalibai da dukkan sauran ma'aikata a wurin, kuma za su tabbatar da hatta wajen dafa abinci, wajen cin abinci da duk sauran waɗansu abubuwa da za a yi an kiyaye, an tabbatar ana bin ƙa'idojin da aka gindaya domin tabbatar da mun yi gaba da yaɗuwan corona. Saboda haka muna fata iyaye za su tarbiyyantar da yaransu domin su bi umarni na malamai, na jami'an lafiya da dukkan waɗanda za a sa domin su tabbatar da cewa sun yi abin da ya dace. Allah ya ba mu ikon yin wannan lafiya a ƙare lafiya. Mun gode.
Gentlemen of the media, good afternoon. And from Civil Aviation, we would say that UAE had commenced issuance of visa today. So consequent upon that, EK, which is Emirates Airlines, will begin operations from tomorrow, are allowed to start daily flights into Abuja and Lagos. Their sister company from the same country, Etihad, they are working on their schedule, and once they do that, they will let us know. They will be discussing with the NCAA. The only airline that goes to UAE from Nigeria is Air Peace. They're also working on the resumption, and they will advise accordingly and will let you know. Well, then we've had, sadly, some 27 cases here in Abuja of passengers that are not complying with our requirement for the PCR negative result test. Some of them appeared with rapid test, which is not accepted and not approved. And some of them came with expired PCR, and some with no test at all. Now, the protocol and procedure is that the airlines that have brought in these passengers will be, of course, will answer and will be dealt with accordingly, according to the law. And for those violations, NCA will be dealing with them accordingly. Till now, airlines are allowed to come inbound with not more than 200 passengers. But outbound, they can carry as many passengers as possible. If there's any review, you will be so advised by the task force. And this is the brief that we have from Civil Aviation. Thank you very much. Have a good evening.
Thank you very much. It's now time for questions. I'm sure we're ready. Question 1.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the SGF. So, with the pronouncement of on school resumption across the country, what does the federal government intend to do with school that fall short of minimum safety protocol? Thank you, sir. My next question is for the DG NCDC. So while I would like to tender my condolence to you and your team over the death of a staff that I think I know who died while carrying out his duty. Sir, what is the agency doing to support those leading our response? And recently, the CDC declared COVID-19 as airborne. I would like to know if this declaration will affect our existing guidelines as a country. My third question is for the WHO representative. So I would like to thank WHO for the RTDs given to us. We also like to know the performance characteristics of these STDs. I think that's all. Thank you very much, sir.
Good evening, sirs. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. This question is to SGF, sir. It seems obvious that some countries are going solo for the development of COVID-19 vaccines. You can understand that by the recent pronouncement of the US President Donald Trump. China is also producing. Russia is also planning its own. Recently also Britain announced that before Christmas there is a possibility of getting a vaccine. So with 200 million people in Nigeria, are you not worried about this development? Is it not time for Nigeria to also go solo? Do you still believe in this global collaboration of 155 countries? It's about who gets it first when this vaccine. A bayyane ke cewa waɗansu ƙasashe yanzu sun fara ƙoƙarin samun rigakafi kuma waɗannan ƙasashe suna neman wannan rigakafi ne na ƙashin kansu, musamman ƙasar Amurka da China da kuma ƙasar Rasha, har ma ƙasar Burtaniya ita ma da alama tana kan samun wannan, kuma akwai bayanai da ke nuna cewa kafin nan da ƙarshen shekara za a samu wannan rigakafi. Najeriya tana da mutane sama da mutum miliyan 200. Shin lokaci bai yi ba da Najeriya ita ma za ta fara tunanin cewa ta samu rigakafin wannan cuta, musamman a ganin yadda waɗannan ƙasashe kowa ke yin ta kansa? The next question is to Minister of Environment. So you say it in English, but I want this in Hausa, sir. Kana maganar cewa za a koma makaranta kuma ma'aikatarka a shirye take don ganin cewa ciki lafiya baka lafiya, ma'ana yara sun koma makaranta kuma ba su kamu da cutar coronavirus ba. Ranka daɗe ka yi maganar feshi. Wane ƙwarin gwiwa za ka ba wa iyaye cewa sinadaran da za ku yi amfani da su ba za su iya cutar da waɗannan yara ba, sannan ka jaddada cewa har yanzu wannan cuta tana nan. Shin wani ƙwarin gwiwa za ka ƙara ba iyayen wannan yara cewa matakan da za ku ɗauka lalle za su sa waɗannan yara ko sun koma makaranta ba za su kamu da waɗannan cututtuka ba? Thank you very much.
Good evening, Chairman and members of the PTF. My name is Mitaire Ikben. I report for the NTA. My first question is for the SGF. I recall that the third phase of eased lockdown is supposed to last for 4 weeks, and as it stands at the moment has elapsed. So I was expecting maybe there will be a new phase announced today. So you tell us if there will be an extension, sir. And my second question is for the DG of the NCDC. Now that we are having fewer positive COVID-19 cases, it will appear that the rate of recovery and discharge appears to be relatively slow and not as high as it used to be. Because for about a month or more, active cases have been hovering around 7,000 plus. So I want to ask what is responsible for the perhaps rather slow recovery and discharge rate. Also for the PTF National Coordinator, with the approval given to schools to reopen, some concerned Nigerians want to know if workers below grade level 12 are still advised to work from home. bearing in mind that they are adults. Then for the WHO, you have just approved 2 rapid diagnostic test kits. I want to know how reliable are these test kits, bearing in mind that you told us before now that generally rapid diagnostic test kits are 50% reliable. That they are 50-50. So we want to know how reliable are these 2 test kits which you have approved. And finally, I want to ask if the PTF has done a post-election assessment or investigation of Edo State with regard to the possible spread of COVID-19. Because that is one state that over a period from the campaigns up to election day and even after election experienced a lot of gathering of people and people coming together. So I want to know what is your assessment of that state post-election. Thank you.
I think we are done with the questions. And as usual, we'll have the Honorable Minister of Health to answer some questions. Okay, you didn't have questions today. DG and CDC, the National Coordinator, the Honorable Minister of Environment, we have WHO, and then the SGF Chairman will conclude. Let's now call on DG and CDC.
Very much. Very good questions. On the addition of the possibility of airborne transmission by the US CDC on the US CDC website, for us in Nigeria, we have always worked for the past 3 to 4 months on the premise that airborne transmission is possible. The major route of transmission, like we've said, has been droplets. But, airborne transmission is definitely possible. That's been scientifically evidenced for many weeks now. And a lot of our strategies around mass and all of that are really based on that possibility. So, in fact, we're surprised that it has taken so long for it to be put up by the US CDC. That's the premise that we've been working on for months now. Mitari, you asked about the slow recovery. One thing that's happened, a lot of the cases being found recently have actually been fairly mild, and so in many contexts, home care, as we have learned more about this disease, home management has really become the mainstream of treatment for asymptomatic cases, people found that don't have symptoms. And because of that, obviously, when they're not in an institutional setting, collecting data for the recovery becomes a little bit more challenging in the state. So it's more a challenge with data collection than actual recovery. We're fairly quietly happy with the recovery rate among patients. Like the Honorable Minister said, the case fatality ratio is coming down, which is a good sign, but we have to always remain careful and watchful and have our guards up because of what is happening globally and the fact that we have opened up our airspaces. So that's why the work that we're doing at our airports is so important to prevent a second wave of infections in Nigeria. The other question was about the Edo elections. We continue to look carefully at the data coming out of Edo. We haven't seen a spike of cases. What is kind of also becoming a little bit clearer is that transmission outside is a lot less likely than in indoor settings. So when you see crowds of people outside, the risk of transmission is not zero. We continue to encourage everyone to wear masks. But we're much more worried when people are in indoor spaces without masks than when they're outside. But generally, our recommendation is still everyone should wear masks as often as possible, especially when outside of the house. A comment before the last one on schools, even though there wasn't a specific question, but I wanted to make an extra point that on schools, the challenge really is not to leave everything to the schools. It's really, this will be a co-production by parents and schools. You know, every child will leave the home to go to the school, and the parent really has to support us in educating our children on this new disease and why it is important to keep doing the things that we have been asked to do. So let's not leave it entirely to the schools, to federal or state government, but really ask parents to work together with schools to get the message across, to socialize the message and keep our children safe. And finally, Rachel, you asked on what NCC is doing. We have done everything possible in the short term to support the family through this very tragic period. The Honourable Minister has announced that we will be looking at what is possible through the mechanisms of the response. But we will go over and beyond what is necessary in this case. The colleague sadly actually died in the line of duty. So it's our responsibility to do our very best, and we will do the best we can. It's early days to announce publicly what that will be, but we'll work with all those concerned. Everybody on the side of government has really been touched by this, and we'll do our best to support the family through this very tragic period. Thanks.
I think I have only one question. So this has to do with the next phase of the response. So yes, you're quite right. We've delayed the next phase of the response because we're still having consultations. We're due to have discussions with the Office of the Head of Service. We're also discussing with the Honourable Minister of Youth and Sports. We expect that we'll be able to provide you with additional information early next week. For the moment, the current phase of the response continues unchanged, but we hope to have additional information. We are also in the process of working with NCDC to do a national testing week for COVID, and this will give us even better clarity in terms of the true spread of the infection and how far we should go with the next phase of the relaxing the restrictions. Thank you.
We now take the Honourable Minister of Environment. Environment, please.
Assalamu alaikum. Tambayar da aka yi akan waɗannan sinadaran da ake amfani da su wajen tsaftacewa da feshe makarantu za su iya ma yara illa? Amsa anan shine a'a, domin waɗannan sinadarai ne da aka daɗe ana amfani da su. An yi bincike a kansa an sani. Majalisar Ɗinkin Duniya ta ba da shawarar a amfani da su, sannan ƙungiyar lafiya ta duniya ta amince da a yi amfani da su, kuma an daɗe ana yi. Har yanzu babu wani wuri da aka ce yau gashi waɗansu sun kamu. Bisa ga tsarin yadda ake amfani da su ne, za a yi wannan feshi ne a bari na wani lokaci, a buɗe wunduna, tagogi kafin a shiga. Akwai waɗanda ma mutane na ciki suna zaune ana iya yi. Duk abu ne wanda yake an duba shi ta ɓangaren kimiyya da fasaha, ta ɓangaren bincike, domin a tabbatar da ingancinsu. Kada a ƙilu ta jawo bau, garin neman lafiya ka kuma samu kare kanka ka kuma samu wani rashin lafiyan. Saboda haka cikin ikon Allah ba su da illa. Sai na biyu, tambayan aka ce, na ce har yanzu corona tana nan, to me yara za su yi don su kare kansu? Tabbas akwai sauran rana aka ba, tana nan. Duk da dai ta ragu, muna ganin yanzu a rana ana samun 100 da wani abu maimakon da ake samun 400-500 ko fi ma. To me za su yi ko su kare kansu? Abubuwan dai da muka rika faɗe tun fil azal. Na farko dai sa takunkumi. Na biyu tazara wajen mu'amala. Na uku wanke hannu akai-akai. Na hudu ka guji taɓa fuskanka, baki, hanci, ido, domin ta nan take shiga. Na biyar, in ba ruwa kusa, akwai wannan sinadarin mai kashe ƙwayoyin cuta a shafa. Duk duk wani abu da aka ce a yi a guji kuma shiga taro na ba gaira ba dalili. Wa'annan suna cikin abubuwan da za su yi. Shi yasa tun farko na ce yara kuma a tarbiyyantar da su bi tsari da ƙa'ida, yi na yi bari na bari, kada ran kada hannu. Assalamu alaikum.
Good evening. Thanks for your questions. I think the two questions were more or less the same. They were about the actual performance of the antigen-based rapid diagnostic test. What I would like to say at this point is the recommended method to confirm COVID-19, the gold standard, is still the PCR test. The antigen rapid diagnostic tests, they differ from the PCR because they are detecting a protein produced by the virus while replicating as it infects an individual. So there are some proteins that are produced by the virus. Those are the ones that can be detected by the rapid test, whereas PCR detects the actual genetic material of the virus. So PCR is the gold standard, is very sensitive. In terms of performance, there are two measures. There is what they call the sensitivity and specificity. The sensitivity is the measure of to what extent the positive result from the rapid test could concur with the positive result by PCR. And for the current test that has been accepted by WHO on the emergency use list, it's about 80%. The specificity is for the negative result. How reliable are they if they give a negative result? The ability to rule out COVID-19. That one, it's much better. For this test, it's about 97%. So those are the performance as they stand now. But when we introduce them in a country, like here in Nigeria, we still need to assess whether those performances hold. So that's why the Nigerian CDC is also doing that study when eventually those RDTs become available. So that's what I can say for now. Thank you.
Thank you very much, WHO. We're now grinding down. We now the chairman of PTF to now come to the podium. SGF, sir.
Yeah, thank you so much. I think Dr. Sani has taken care of all the questions I was asked. Walter, did you answer the question that had to deal with vaccines? Okay, well, I'll make an attempt there. Rachel, schools that do not follow guidelines, what should happen to them? From the statistics that you've just heard from the Honorable Minister of Environment, federal government has just 105 schools all over the nation that are reopening. Over 18,000 schools do not belong to the federal government. They belong to states, private proprietors. And control of schools in the states is the responsibilities, particularly secondary schools and primary schools, is the responsibilities of the state governments. They are supposed to ensure, because you notice we did not open schools. We just provided guidelines. But different states have fixed different dates for the opening of the schools. So the responsibility for ensuring that these schools comply with the guidelines is vested in state authorities and local government authorities. And that we expect they would do. This evening at about 8 o'clock, we will be on a virtual conference with the subcommittee of the National Economic Council, comprising about 6 or 7 governors, chaired by the governor of Delta State, who is the chairman of that subcommittee. We oftentimes engage so that we can coordinate the national response. This question that you've asked would be raised there. What are they doing to ensure that the guidelines that have been jointly produced with their inputs, with the Federal Ministry of Education, collaborating with the State Commissioners of Education, and private stakeholders, and the Nigerian Center for Disease Control, with the Secretariat of the PTF, came out with the guidelines that were issued. What are they doing to ensure compliance with those guidelines? And probably at an opportune moment, we'll be able to report back to you as to the level of compliance state by state. Because the infrastructure for compliance is dependent on the states. And the enforcement measures are also vested in them. But I believe because the ones that will be going back to school are our children, we must do everything to ensure that they are safe to return back to school for in-person learning before those schools are open. Nobody will want to endanger his child. So I expect that there will be a high level of compliance with the measures and the protocols that are being introduced and also sanctioned by the states and the private proprietors of most of the schools. Farouk, you raised the issue of the solo nature that is being embarked on the production of vaccines. Consistently, the United Nations and the World Health Organization have insisted that for the world to overcome the pandemic of coronavirus, it's a collaborative effort and all countries must be involved. And you can see the peril with which countries that have decided to go solo are being confronted with. It's a joint collaborative effort that would help the entire world and humanity navigate the impact, especially the adverse impact of COVID-19. Nigeria will continue to cooperate with other nations under the Solidarity Triad, even as our scientists are busy in their laboratories, in their institutes, to try to produce a homegrown solution for COVID-19. I think the last time we briefed the nation from this podium, the Minister of State Health did show you a pack that came out of the effort of our research institute, particularly the Nigerian Institute of Medical Research, the efforts that are being put in place to even get a home-produced test kit that would drastically cut down the costs of what we are procuring now. Except for the rapid result test kits that we are trying to introduce. The PCR test kits come to about 18,500 per each test. It's a lot of money. Simple reason, because we don't locally produce it, and it's a very scarce commodity that the entire world is chasing after one commodity. So the producers of these test kits have absolute control of the market, and they can determine the prices at which they sell. So I believe under the auspices of the World Health Organization and other multilateral organizations, Nigeria will continue to pursue the production of vaccine that will be tested, that the efficacy can be acknowledged before we allow its application in our country. Definitely, you can see the politics of vaccine all over the world. It is even determining a major election in the world. So is COVID-19. Has become a determinant factor of a major election. That is the nature of COVID-19. It's a novel virus. Nobody has ever gone the route. Nobody has ever charted the route. And it has the capacity and the propensity to determine what happens in the world. It has impacted on the economy of the world. It has impacted on the health of the world. It has impacted on our social, civil life to the extent that today, I can't remember the last time I shook hands. It's totally un-African. But you see, this is the new normal. There's nothing we can do about it. And I've said it consistently that whatever you want to do in life, if you had aspirations at the beginning of this year, I think the most important thing for you now, the highest figure on your aspiration list should be, how do I navigate and remain alive at the end of 2020? Because it's a major challenge. It has challenged our livelihoods. It has challenged our lives. It has impacted everything that you think about our civility and our social life. And it continues to it has continued to confront the entirety of human race and humanity. And the best we can do as a people is what exactly we are doing now. Like I said in my remarks, that together we must take responsibility. Our 60th independence anniversary gives us an opportunity. But the truth about it, let me say it, without any fear of contradiction, COVID-19 also it provides us with an opportunity to reconstruct everything about our nation, from our governance structure to our health institutions, to how we deploy our resources to create for inclusivity of the civilian population so that nobody is left behind. It provides us with that opportunity. So it is not all about woes of COVID-19. Yes, we have lost loved ones. But should they die in vain? We must utilize the opportunity that is being provided by the losses that we've incurred in terms of loss of lives, loss of livelihood, and the negative impact of COVID-19 to set a trajectory for sustainable development in this country. Mitare, you are asking whether this phase has lapsed and what next? It's been a very busy 2 weeks, from one thing to the other, from one thing to the other. And we have deliberated extensively. The next step might be major. So in a considered and cautious manner, we are weighing every option. And very soon, the nation would receive whatever instructions going forward. Looking at what is remaining in the sectors that have not been opened, looking at the other steps that we need to take, even in the areas of entertainment, creative industry, sporting, and the rest of it. There are major leaps. And in addition to that, we have decided, we've stated it, and I believe that the President has sanctioned it, that we will have a dedicated week of testing. If we're going to test in 774 local governments, That will give us an indication as to what has happened all over the nation before we can now decide on this major leap going forward. So there are so many things that we are setting in place. 4 weeks, 5 weeks is not cast in iron or stone. It's a period, and we are looking at all the options before we can make recommendations for Mr. President's consideration as to the way forward. Having said that, what that presupposes is that we are still in the phase 3 that was announced on the 3rd of September until we are able to conclude this exercise and now advise on to the next forward. So I want to thank you, particularly members of the media, for the wonderful job that you have been doing. Without you, these messages will not go out there. You have done very well. And even as you continue to celebrate the 60th and diamond jubilee of our nation, I believe that together, if we walk hand in hand, we can change the course of the fortunes of this nation and set our country on the path of sustainable development and growth. A nation that will cater for our people, a nation that will provide for the well-being of our people, and a nation that would allow each and every one of us ventilate whatever aspirations we have. Thank you, and good evening.
Thank you very much, Chairman, for that conclusion. Just in case we miss some part of today's briefing, well, we have take-home message. Please permit me to now invite our new Permanent Secretary, GSO, Dr. Morris, to now tell us the messages we need to take home. Dr. Berry, please.
Thank you, Mr. Chairman, for your last speech, words of encouragement. With Mr. Chairman's speech, we have come to the end of today's briefing. I want to thank all that are here today, the members of the PTF and the media, and every other person that's here today. I am pleased to be part of this national response effort by the PTF. Before we go, I want to give some words of encouragement and advice by way of a take-home message. First and foremost, today, the danger facing our frontline workers came to the fore with the loss of one of us, Mr. Uche Njoku, of the NCDC. We share in this grief as a nation because he died fighting for humanity. The unknown gunman cut short his life while he was on a national assignment. We pray that the Almighty God will grant his soul eternal rest. We have been reminded to take steps to respond and prepare properly as we reopen our schools and expand our airspace. The advice there is that you should avoid non-essential trips to high-burden countries. To reduce the risk of COVID-19 importation, we urge all travelers to cooperate fully with our border officials when they travel. Testing, dictation, training, and treatment still remain the most viable strategy. Our network can take care of about 3,500 tests daily, as there are laboratories now in every state. So you're advised to avail yourself this opportunity and get tested. Finally, the Ondo election will come up on Saturday, 10th of this month. We all know that it's a huge operation involving about 1.5 million voters. We remind you of the risk involved and urge that strict observance of the guidelines is enforced. We pray for an infection-free, violence-free election in Ondo State. Please bear in mind that INEC has just issued a guideline that no face mask, no voting. So it's on that note that I want to thank all of you here today that have attended this briefing. I hope to see you at our next briefing on Monday. God bless Nigeria. Thank you.